This is the Navajo Nation. It occupies territory in 3 states, Utah, Arizona, and New Mexico. It's the largest land area retained by any of the over 500 indigenous tribes in the United States. With a population of over 170,000, the Navajo have their own elections, police force, and public services. But as of recently, it's become a hotspot for the coronavirus.
Coronavirus is ravaging the Native American community, especially the Navajo Nation, which has the highest coronavirus infection rate per capita in the entire U.S.
Well, the Navajo Nation has been one of the hardest hit areas of COVID-19.
Well, there have been almost 1,200 diagnosed cases of COVID-19 on the Navajo Nation.
Despite the rural nature of the Navajo Nation, the reservation surpassed New York State in May for the highest COVID-19 infection rate in the U.S. That's due in part to the fact that 15 to 30% of all residents don't have access to running water. The few grocery stores means high contact areas. But more importantly, a lack of access to hospitals makes urgent care incredibly difficult. Those in critical condition have to be airlifted to nearby hospitals. In May, Doctors Without Borders dispatched teams to the Navajo Nation, the first time Doctors Without Borders has set up teams within the United States. In May of 2020, Congress passed the CARES Act, another stimulus package aimed at getting Americans back on their feet. $8 billion of that was allocated for Native tribes, but the Navajo administration has been waiting to see the $600 million fully processed by the Treasury, causing a collection of tribes to sue the Treasury. Like many other communities, COVID-19 is accelerating and exacerbating problems that already existed, and that's no different from the Navajo. But this isn't the first time epidemics and pandemics have hit indigenous communities the hardest. It causes us to question how we as a country need to think hard about how we value the first people of this nation and land. And are we doing enough to honor our treaties?
All day you will be safe. Alter your course.
COVID-19 can be characterized as a pandemic.
While natural illnesses and pandemics have impacted indigenous peoples throughout the history of the colonies in the United States, colonization and westward expansion have brought disease, sickness, and death to Native communities. But as COVID-19 slams the Navajo Nation, our fragile relationship with the U.S. government makes getting resources incredibly difficult. To understand that relationship, we have to go back to the Civil War. As the U.S. continued to push west into indigenous land, war broke out between the Union and Confederate states. By 1862, the Union had pushed back the Confederates to the Rio Grande. The U.S. turned its attention to the Navajo, who had fought to protect their land from the Confederates and Union alike. Major General James H. Carleton ordered frontiersman Kit Carson to put down Indian reservations, forcing the surrender of the Navajo people. In late 1863 to 1866, the U.S. government marched over 10,000 Navajo people from their land to Fort Sumner Bosque Redondo Camp, where other Native American tribes resided in internment camps. It was the U.S. government's attempt at ethnic cleansing, and the conditions the U.S. government housed the Navajo in contributed to 2,500 people dying from disease and starvation. This became known as the Long Walk, or as the Navajo refer to Fort Sumner in Diné Bazad, the Navajo language, Huelde, which means place of suffering. And despite the Department of Defense contributing the most amount of money to the Fort Sumner Memorial, the U.S. government has yet to apologize. While this provides a historical record of disease impacting the Navajo people, the emotional scars of an often hidden and shameful part of U.S. history explain a lot of the prevailing problems throughout the Navajo Nation. According to Navajo historian Jennifer Dennett Dale, quote, severe poverty, addiction, suicide, and crime on reservations all have their roots in the Long Walk. It's also shaped a tense relationship between the U.S. government and the Navajo people. In 1918, the influenza pandemic killed 50 million people around the globe, and Native Americans suffered. In 2014, researchers writing for the American Indian Quarterly, produced by Nebraska University, estimated that Native Americans had mortality rates 4 times higher than the wider population. And while the nature of the virus did not discriminate amongst ethnic groups, there was, quote, substantial social differentials in its lethality. Much like COVID-19, influenza's communicability was reduced with social distancing and face coverings. But information shared by the government to the Navajo was poor. The U.S. Public Health Service of 1919 had to make estimates on the mortality rate associated with the Navajo. One local New Mexican newspaper began covering the impact on the Navajo but didn't keep data. And according to the University of Nebraska study, quote, the losses the Navajo experienced were greater than most of the rest of the nation, greater than many other tribes, and greater than the government would acknowledge.
Ladies and gentlemen, in late April, WHO announced the emergence of a novel influenza A virus. This particular H1N1 strain has not circulated previously in humans. The world is now at the start of the 2009 influenza pandemic.
In 2009, the H1N1 virus again ravaged Native communities at disproportionate rates than the wider population. And while many of the same problems prevailed with the US government, there was a greater attention to the issues of the Navajo people. The Obama administration was praised for having addressed the needs of Native tribes more than any other administration. Obama was only one of 3 presidents since 1934 to visit Native American land. But a pattern and practice of neglecting the needs of Native tribes have been apparent throughout the COVID-19 pandemic. In March, Navajo President Jonathan Nez asked the federal government for emergency aid, weeks before the first confirmed case of coronavirus in the Navajo Nation. His request was never responded to by the government. As of July 1st, the Navajo have recorded a total of 7,613 cases and 369 deaths, making it the hardest hit per capita region anywhere in the U.S. President Jonathan Nez has expressed the need for direct aid from the federal government. The Navajo president has implemented one of the strictest lockdowns in the United States, with the 57-hour curfew over weekends extended through July 26th. Aside from a lack of access to medical facilities, the entire reservation has access to only about 20 ICU beds, and local doctors have been pushed to their brink. Unpaved roads, coupled with unregistered houses, make it in some cases impossible for ambulances to access those in critical condition. It sparked an outcry from celebrities and influencers demanding changes to the status quo, and President Nez is hoping it has a lasting impact.
15 to 30% of our Navajo citizens don't have running water. And not just water, infrastructure, electricity, broadband. We don't have the best internet access. And all we want to do is just to be at the same level as everybody else throughout this country. But this highlights that the first citizens of this country are still sitting in poverty.
Regardless, the COVID-19 crisis has sparked a long overdue conversation about how we value the first people of this nation, who have long been taken advantage of by the US government, who have not upheld their end on treaties. But former Navajo Nation Health Executive Director Anselm Roanhorse made a key point during the H1N1 crisis.
The Navajo Nation is only one of the over 500 Indian nations in the country. And each nation is different. It has its own culture. It has its own way of looking at things, own values, and own way of dealing with different emergencies.
While the Navajo are the largest tribe in need of the most federal funding, they are often the first tribe considered amidst national crises, leaving the smaller, less well-known tribes forgotten. There is a genuine fear that unless proper action is taken, the culture and customs of the people of the First Nations are at risk of disappearing. So much of Native history is preserved in oral history of stories passed down from generation to generation, and perhaps Navajo teachings can help guide us through this pandemic.
In times of crisis like this, people of course panic and don't know what to do. We have to remember everything, has a purpose. And so we believe that this is a new beginning. In times of other pandemics, everybody would have to kind of go into seclusion, go into their homes, and especially during the winter, it's a time of quiet and reflection and peace. My mother said that this is a good thing because Mother Earth is getting a break from humans. The pandemic, for some families who are losing loved ones, it is really hard. But at the same time, this life cycle process continues, and we have to remember that we belong to Mother Earth.
Shannon Francis, a member of the Hopi tribe and Navajo Nation.